Hello, good evening, good afternoon, good morning and welcome. It's Nurse Richard, the Wax Wizard. Thank you for joining me for this very interesting and potentially serious case. There is a bit of a backstory with this one. As you'll have guessed from the title, it is something potentially quite serious. This chap, he said he'd had trouble with his ears for a very long time. I never had anything done about them. However, now I've just removed the first blockage there, and I believe it wasn't this ear that was causing him the most trouble, although you can see it's incredibly retracted. You've got pockets all over the eardrum where it's really being sucked inwards, usually due to a negative air pressure behind the eardrum. And that can cause, obviously it's very retracted, but it's not caused a bigger problem as it did in the other one. Some of the more eagle-eyed ones might already spot it in the second ear here, what the problem actually is in the distance there, but we need to just remove this so we can get a clear image, because that's where I want to sit the endoscope to have a full look at what we can see lurking deep down there. Now the story with this gentleman is, I don't think he'd ever had any procedures done on his ears before. However, he was a hearing aid user, so he was regularly seen. Now, I think he was a hearing aid user and he used to see public health. He didn't go to a private audiologist for them. It was done in public health, so he had like NHS hearing aids. So quite commonly saw the audiologists there. Now, he said he thought his hearing aids weren't working very well. And so he went to see them and they said, yeah, you've got a blockage in your ear, the first one that you've seen on this video. So you need to go and get that sorted out. Too long a wait to get that done on public health, so he came to see me. And they looked in this ear, which you can see me working on now, and they said, no, that one's fine. That one's okay. There's nothing wrong with that one. And to say I was shocked that you can miss something like this. And this was none of this high street chain receptionist. This was a trained professional who missed this. Whether they watch my videos or not, I don't know. I don't know who they were. I just know it was somebody in public health who was trained and should have spotted something like this, no matter what device you use. Even if it's just the handheld endoscope that you look through that shines a torch in, it would have been very difficult to miss this. It would have been pretty obvious, because as you can see, there's a really hardened ball of keratin that's collected in one of those pockets. So this is kind of, as you've seen with the first ear, they had these pockets all over the place. And he's clearly got a big pocket in this one too. And what's happened is when it's a lot, you'll know this, I'll know, but I'll briefly explain what happens. So the eardrum sheds itself from the middle outwards, goes radially like that. It's always constantly shedding. And because he's got a pocket, like a dip like that, so when the skin is shedding along the surface of the eardrum to the outside and then along the canal wall, it's fallen into this pocket and got trapped there, and then it's been collecting in there for how long, I'm not sure. A fair amount of time, I would hazard a guess at. I have put some olive oil in this. You can see it kind of sitting at the bottom of the ear canal, because when I first looked at it, I thought, well, my first thought was, should I do this? Because you always need to be aware of complications and your own limitations as well. We had a saying in nursing, it was quite a common was, where you should never work beyond the scope of your practice. It's in our code of conduct, actually, where if you don't feel confident or trained enough to do something, then you absolutely shouldn't do it. So what I first gently started, this is all done with the fine end tube. You wouldn't entertain a full-size tube down here. This is minuscule, the proportions you can see here. I'm really close to it, but it looks huge. It's really not. It's absolutely tiny, and tiny movements that you have to make with this. Talking millimetres, the size of the things you can see in there. They should have still spotted it though, to be fair. So what happens, yeah, it's collected into one of these retraction pockets, and then as the skin in the eardrum still keeps shedding and shedding, it gets bigger and bigger and grows. Now obviously some of it has grown upwards, it's got this tail and it's been growing outwards, but what's happened behind the eardrum is what we'd be most concerned about, to be honest with you. That's why I started really gently when I was touching it. I'm looking to see if there's like any movement behind the eardrum that's obvious, or if he's getting any pain or any discomfort. He didn't feel a thing throughout the whole procedure, which is why I was happy to try and remove this. What I didn't like, now you can see obviously the olive oil sitting down at the base of the ear canal. It was sat upright, wasn't lying down. But the colour behind the eardrum, it doesn't look right to me at all. You'd normally expect like a greyish blue tinge, which you could see in the other one. It was still incredibly retracted, but the colour was okay. But you can see it's not in this one. You can see it's like a straw coloured. It's certainly darker than it should be. And that would make you think, what's going on behind this eardrum? Has this plug of skin that's collected in this pocket then been growing inwards? And by definition, that's what you would call a cholesteatoma in the middle ear, a collection of dead skin that's worked its way through the eardrum and then collected inside, can cause discharge, infections. He had very few symptoms, by the way, other than not being able to hear very well. He had no pain, not noticed any discharge, there's no obvious infection in the outer ear canal. But there's clearly something not right in the middle ear. You can just see this pulling away. This was really delicate work to do. Excuse me. I can't begin to tell you how difficult it was and how delighted we both were when it came out. But it was, yeah, and people say it must be quite nerve-wracking doing stuff like this. It is, I'm not going to lie. You obviously have to be really careful. You just about see it lifting, can't you? And as you see it lifting, there's dark areas behind it as it's slowly moving to one side, which tells me that there's something down there, or it's definitely been burying in down there. And it did take a while. It took a few applications of oil as well. You're obviously seeing an edited version of this. There you go. Can you just see at the top of that? I was hoping it would all come out then, but it just broke away a little piece, which was a little frustrating. But it does come in the end. But I'll be honest, it annoyed me, excuse me, when I saw this. And I thought, how has someone who's trained missed this? And as you know, if you watch a lot of these videos from myself and the other guys out there, you'll know what a problem it is. People doing stuff like this, who aren't trained, who aren't even medical professionals, of which there's zero regulation to stop anybody from doing it. If you're not a medical professional, that includes nurses, doctors, audiologists, ENT, you know, anyone can do it. I've seen loads popping up here, tattoo parlours, hairdressers, barbershops, you name it. They're all having a go to make a quick buck because obviously the public health system can't cope and is winding back the provision of these services. And that's bad enough. But to have trained people missing these things is worrying. It really is. Now, is it because they're not given enough time for appointments? It takes 2 seconds to look in and spot this. So I'm not buying that one, unfortunately. So obviously it got an urgent ENT referral, this gentleman, to our local ENT department. Hopefully it can get done quickly. I will keep you posted what I hear. I don't always hear from them, but I know they know of me, because I know that a recent patient of mine went to see ENT about something else, and they said, I can't get in to see you guys to have this done, but I've heard of this other guy, i.e. me, and they said, oh, absolutely 100% go and see that guy. So it's nice to know that they know of me and they recommend me, even though they're not really allowed to recommend a private service. Now you can see this starting to come, and you as did I, you won't like the look of this behind it. So we'll obviously need a scan to check out what's going on behind here, and hopefully they'll get it done relatively quickly. You can see it's just clinging on there, can't you? So I'm not yanking this out. I'm trying to do it as gently as I possibly can, because I don't want anything to come with that shouldn't come with that. But we'll get it. It just got stuck on the outside there. So let's go and grab that. Let's go and have a good old closer look inside to see what we can see behind that now. Look. You can obviously see there's still a crater there. You know, there'll be little areas and pockets in there that you can't quite see because you can't get the endoscope just up underneath that portion there. But I highly suspect there's something not quite right going on behind that eardrum. I think it's quite obvious, in fact. But we're hoping for a good outcome anyway. If I do hear something, I will let you guys know. Needless to say that the chap in question, he was absolutely over the moon that we managed to get that. And he was as miffed as I was that it wasn't spotted. Because even before I explained to him what it was, I showed him an image as we were doing it. He's like, well, that's not right. How did they miss that? How did they miss that indeed? Anyway, I hope you enjoyed that. I will keep you posted. But for now, take care of yourself and I'll see you soon. Ta-da.